I'm Dr. Rick Buck, and I've been a dentist for 17 years. In this video, we will quickly go over the complete process for digitally making permanent implant dentures. Here's the current situation in the patient's mouth that we have here today, and we're going to give him a cosmetic set of teeth that look like this in the end. But let's get started with the first appointment. The first appointment is a planning appointment. In this appointment, we take a lot of measurements, pictures, digital scans, and CT scans, because after this appointment, we're going to take all these digital records and superimpose them on our computer software. The most important measurement we take is the mouth at rest and the upper lip position when the mouth is at rest. We are trying to plan the end from the beginning. And when the mouth and lips are at rest, we want to plan for the edge of the central incisors to be 2 to 3 millimeters below the edge of the upper resting lip. Generally speaking, this is the best place to start for cosmetics of teeth. The reason why we start here is because they are going to frame the rest of the cosmetic smile. So after that measurement, then we start to plan for the final implant dentures, and we want those to have a minimum thickness of 13 millimeters in height. But ideally, they would be around 15 millimeters thick or even more. We plan for the permanent denture at the end to have this thickness because at this thickness, it will be unlikely to break. So once again, once we know where the edge of the upper teeth will be with the jaw at rest, we want to plan for the edge of the lower teeth to start 3 millimeters below that. This makes what is called the freeway space. The reason is when the mouth and jaw are at rest, the upper and lower teeth are about 3 millimeters away from each other. And just like the uppers, we plan for the lower dentures to ideally be about 15 millimeters in thickness, but 13 at the minimum. When you add it all up, we need about 33 millimeters of space from the edge of the ridge of the upper gums to the ridge of the lower gums when the teeth are taken out. And if you achieve that, you can attach a solid denture that is going to be cosmetic and unlikely to break with your strong biting and chewing forces. Herein lies the biggest issue that we have. Most people don't have that much room even when we take out the teeth. So since we're in the planning stage, we plan to make that room by removing enough bone on the day of the surgery to allow for the thickness of the hybrid dentures. In other words, on the day of the surgery, we're gonna file down the bone so it creates that much space. And so once we planned and eventually drilled the bone away, there will be a new crest of the gums. But also, this crest of the gums is going to be a transition line between the gums and the fixed denture in the future. And don't worry, you'll see all of this in a few minutes. But we plan for this because you never want to see this transition line when everything is finished. The last important step at this appointment is to get a picture of the patient smiling as big as humanly possible for them. So if the patient's upper lip moves past or higher than 15 millimeters when they are smiling really big from where the edge of those central incisors will be, then you would actually see that transition line. So if this is the case, we have to plan for that bone removal to be even higher so you can't see the transition line when they're smiling. And so if you do that, the final transition line will always be hidden even when the patient is smiling their biggest. Now, this was not a problem for our patient in this video. When he smiled, he just didn't show that much teeth. So now that you know the numbers and what we're actually doing, let me show you how we meticulously plan for this. We take a picture of the mouth at rest and we superimpose the 3D scan we took by lining up the scanned teeth position over the position of the same teeth in the picture of the mouth at rest. And with those superimposed, we know where the teeth, gums, and jaw are in relation to the resting lips when the patient is just talking and being normal. Now, once we have it all lined up, from there we can make a digital 3D denture lining up the new central incisors around 3 millimeters below the resting lip line, and also with a complete thickness of about 15 millimeters along the whole upper arch. And then we do the same thing for the bottoms as well. And once we're happy with the placement of all the teeth, and once we've designed the fixed dentures to our liking, we can then know how much bone we need to remove to achieve this. In fact, from the digital 3D denture that we designed in the software, we're going to make the actual dentures and temporary dentures and a 3D printed guide that will show us during the surgery the exact level that we want the bone drilled down to. And now to make that guide, we can also line up the scan we took and superimpose that over the CT scan that we took. And in case you didn't know, in layman's terms, a CT scan is just a 3-dimensional digital x-ray. Now, just to put all that together, we have the 3D scan in relation to the 3D denture that we designed, and also those in relation to the teeth and jawbone from the CT scan. So we know exactly where the denture needs to be in relation to the CT scan, or in other words, that 3D x-ray I talked about. Now, with all that put together and planned out, we can also plan out the exact sizes, locations, and amount of implants that we're going to use for the surgery. Now, just to let you know, the bare minimum, we want at least 4 implants on top and 4 on bottom, which is why some people call these all on 4. But if possible, we want more implants, so nowadays we call them all on X dentures. But we know that we want that X amount to be at least 4 or more. Now remember, we are making a 3D guide for the surgery, and that same guide shows us the new bone level, but it will also have along that guide a long slot that shows us exactly in what positions we can make the sockets that we are going to put the implants into during the surgery. And so this will take us down to the day of the surgery. So now when the patient arrives, most of the time they are put to sleep and we are ready to go. Okay, so before we get into the surgery, something that's gonna be important to know from here on out is that everything in the computer is digitally lined up in the software by structures that are solid. And up to this point, that solid thing that we're using to line everything up is the teeth themselves, because they're solidly in place. But those are going to be removed very soon. And so once those are gone, we need something else solid to line all these scans up in the jaw. So that's where these little things called tracers come into place. We first screw these tiny tracers or tiny little mounts into the bone of the patient. After these are in place, we take a scan with them and the teeth still in the mouth. So with these hard fixtures in place in that scan, we can then line up the solid teeth to these solid tracers in the software. So now we can superimpose all the future scans that we're going to be taking to the past scans because we have these solid tracers in the mouth. Now that we've taken that scan and we've lined it up in the mouth, we start to make incisions and start pulling back the gums to expose the underlying bone. And this is all done with the teeth still in place. So now this next part might look a little funny, but just in case this guide that we made fails, we still have planned how far down we would generally need to drill the bone. And so the oral surgeon right now is marking with a sterile pencil on the bone where we need to drill down to, just in case the 3D guide just does not work at all. And so with those pencil marks in place, we finally start pulling the teeth. You'll notice that his teeth actually are already kind of loose, and this is because the patient has gum disease. In fact, just for your information, most people end up in dentures because of gum disease, as opposed to rampant cavities or trauma or other things. And that's helpful in this case because the teeth are going to come out relatively easy, as you will see here, and that's because the gum disease has done a lot of the work for us. And while most of them are coming out easily, there will be some a little more difficult, like the canines here. They always come out, but some will be a little more difficult and some obviously a lot more easy. And so here we're putting in place that guide that we made, and it shows us exactly where we want the bone level file down to. And now the surgeon just marks that level in graphite, and with the gums moved back, the next step is to just start filing down the bone to the indicated level. Now this step actually takes a lot longer than removing the teeth, especially if you have a lot to do, but you get the gist of it by what I'm showing you here. And so now we have the bone level exactly down to where we want it. So now we use that guide to start marking where we want to put the implants along that little slot that we made in the 3D guide. And so we mark each spot in pencil right where we want those implants placed. And so once we have those dots, you'll notice that we start to make 6 little pilot holes in the bone where those spots are, because ultimately that is where the implants are going to be as well. Now, after we've made each pilot hole, you'll see we're putting in these little metal markers, and these ensure that we are lining up the implants close to parallel with each other. In turn, ensure that the final prosthesis will engage with each implant as well. After each pilot hole we have done, we go back in with a series of drills, each one a little bit wider than the previous one. And this will widen each of these sockets to the size of the implant that works best for the local bone thickness in that spot. Okay, so now after the size of each socket matches the desired implant size, we move on to inserting the implants. And just so you know, each implant is made of nickel titanium and screws into place. At first, the implants are held in place by mechanical retention of these implant threads. However, over the next couple of months, the implants will integrate with the bone itself. But until that time, for everything to be solid, ideally we need the implants to stay in place with about 20 to 30 Newton centimeters of force. And when we're putting these in, our devices measure that that's about how much tightness we're getting out of each implant that we put in. And if we're not getting that solid stability, we have to find a new solid spot of bone for the implants until all of the implants firmly attach into place. Now, as I said, each implant has threads on the outside that hold it into the bone, but they also have a hole on the interior with threads as well that will accept a screw. In other words, it's the female part of the screw complex. Now, that center hole in each of the implants is where we will screw in pieces that are called multi-unit abutments, or MU abutments. This is the gold piece that we are screwing into the implants. Now, just like the implant has a male end that screws in and a female end for another screw to go in, the MU abutment also has a male end that screws into the implant and a female end that will eventually accept a screw that attaches to the dentures. Now, once we verify that all these implants and MU abutments are in a good spot, we attach white covers to help keep the gums away while we're finishing the rest of this procedure. Okay, so now another important thing to know is to be able to fabricate the implant dentures or do anything while the patient is not around, we have to know the exact orientation of the MU abutments and the implants. And we need to be able to scan that into our software so we can superimpose all of our current positions of the implants over the past ones and for the future ones as well. And once again, this has to be exact. So to do this, we need to make what we call a verification jig that coordinates and registers the positions of all the implants in their MU abutments. We specifically use a device here called OptiSplint to make this verification jig. To do it, we screw in the base pieces of the jig into each of the MU abutments. Then we cut down and approximate that mesh to the attached pieces. Also, with the implants covered, but before we attach the mesh, we put bone graft in everywhere there's a socket left behind. This graft reduces the amount of bone collapsing as everything heals. Then we attach the mesh to the base pieces by injecting dual cure resin into the base as it flows along the mesh. So as it flows and connects the mesh to the base, we will give the resin an initial set by light curing it, but it will also set more firmly over time on its own. You need to use a specific resin for this because it doesn't shrink and keeps its exact form, so we can trust the orientation of the implants and MU abutments that this is going to register. So now, once we have that OptiSplint firmly set and splinted together, we can scan the OptiSplint, the mouth, and the tracers that we put in place at the beginning. Because we are scanning the tracers with the OptiSplint in place and before with the teeth still in place, we know exactly where the implants are in connection with all the previous records, including the digital scans and CT scan that we took before. And that's how we continue to line everything up. And so now these implants are the hard structure that we will use from here out to register everything, as opposed to the teeth that we were using to register everything before. And so now we actually unscrew and take out that OptiSplint, and on the side we will scan that OptiSplint just to make sure that we have the exact dimensions of it. And so once we have arrived at this point, we have 2 simultaneous treatments going on at the same time for the rest of this appointment. One pathway of treatments will be done by the surgeon, and one pathway will be done by the lab technician or the dentist. What the surgeon is doing is finishing the procedure on top and then starting the exact same process on the lower teeth. So once he finishes on the top, he puts on the white caps and a resorbable membrane over the bone grafts and sutures everything back up. And then he'll move on to the lower teeth. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Meanwhile, the lab technician starts the process of making the temporary or provisional implant denture. First, he takes that optisplint and he connects it to dummy or analog MU abutment implants. He then takes this cement or stone and places the optisplint matrix into it, as it's a fast setting stone, so it goes from liquid to hard in just 30 to 40 minutes. So this complex with the analog implants and MU abutments and optisplint will set into place over the next 30 to 40 minutes. And then we will have precisely and permanently recreated the orientation of the implants outside of the mouth. From now on, anything we make, we can verify it will insert into the implants perfectly by trying to in first into these analog implants and MU abutments that are set in stone. Now, one of the reasons why this process I use is better than what other dentists do is you have this jig from the time of the surgery and on should anything happen. For example, if the provisional prosthesis that we're making breaks, you can make a new prosthesis that day without the patient even there or even coming into your office. Ironically, I rarely have temporary implant dentures break like other dentists more commonly do. So I hardly need this option available, but if I do, I can do all of this without the patient even around. Now, while all that is setting in the stone, the lab technician is superimposing all of the scans, modifying the design to the current oral environment, and adding digital analog implants into the 3D scans. Since the prosthesis has already been designed before the appointment, we just need to add the MU abutment attachment housing sockets and also the screw channels into the 3D denture design. And we build up any weak spots we've made while creating these features. Also at this time, we add bars into the design of the provisional to minimize distortion and add strength in the fabrication process. Now we just 3D print the provisional with a very strong medical grade resin. If you have a great medical grade 3D printer, this won't take too long. And also just to note, we print 2 of these provisionals or temporary dentures in case something goes wrong, or just to have an extra one in the future in case we need it. Then we take those provisionals and break off the resin from the plate and break off the prosthesis from all the little supports that it's connected to. Next, like with any 3D printing of resin, we rinse the chemicals off the resin, wash them, and light cure the resin again for the final set. And with all that printed out and done, we now add the metal housings into the implant dentures that will engage with the MU abutments. So each of these is going to connect with the MU abutments. And with those in place, before proceeding, we verify the fit with the analog implants that we have set in stone. And ours fits passively, which is a good thing. So now that we verified, we cement the MU abutment housings into those sockets that we made. Next, the technician smooths off all the little bumps and irregularities on the provisional hybrid bridge, and he cuts off the supporting bars as well. And then at this point, we start the process of refining the dentures. We define all the lines in the dentures more and add small depressions and more natural looking features into the teeth so they don't look computer made, but something more natural that the patient can be confident with. And then finally, with this prosthesis, we add color to the gums. We tried to add a little color variation in the gums that you would see with natural gums so that this looks lifelike. Now, with all that finalizing, back to the mouth. This is what everything looks like right before we put the temporary teeth into place. The gums are really raw and inflamed. Now you can see that you are getting teeth in a day, as they call them, but it's a long day. I mean, if you're doing both arches of the mouth, this can take 8 to 12 hours. The surgery is only a few of those hours. Most of that time is actually the lab technician and or the dentist designing the temporary dentures. And another note, sometimes things can be sore for a few weeks after you do these. We hope that that's not the case, and those are kind of the two downsides to this procedure on this day. But that being said, these temporary implant dentures always look amazing and are such an improvement cosmetically and functionally right away, even with the provisional implant dentures. So we finally ended with the surgery with the temporary dentures in place. And here are a few pictures of what they look like right away. But the patient loves the way they look right off the bat. Now, on the back side of these dentures is hidden and sealed off where we screwed in the prosthesis into the MU abutments. The patient uses these provisional dentures for a few months. Initially, things will be quite sore as everything heals. So they are also given instructions on what to eat. Basically, until the final dentures are done, you want to eat soft foods because these can break or cause problems with too much force or excessive carelessness while chewing and eating. So you must be gentle with them for the next couple of months. But yes, they are going to look great. Now, as part of the process, as things are healing over the next few months, we want the patient to make note of many things. How they function with eating and speaking, also how the jaw feels, and what they like or don't like about the cosmetics, including the shade of the teeth. Our patient loves the way they feel and look, but wants them to be a lighter shade than he originally chose. Now, those were his concerns. I, on the other hand, think we need a few other changes cosmetically. For example, he's showing a little too much of the lower teeth when he smiles and not enough upper teeth. But that being said, that is what I love about this process that I'm using here. All of that is so easy to adjust. With other methods, you have to start all over if you want to make adjustments to the design. But here with this process, we can just bring them down a little bit in the software and use a new shade and make a new set of teeth to try, and as we make new ones, this will ensure the patient likes the final product before we even make the permanent dentures, because they will be patterned after this design. Other methods, each new set is a completely different design, including the final permanent set. So you really don't know what you're going to get in the end, and the process is not predictable, whereas in my method, along the way, you're designing the permanent design with the patients and your input. I have done both ways, and this way is much more predictable, and the patients even love it more in the end. Now, after 6 months of that patient being in these dentures, everything has healed, and the oral surgeon gives the clearance for the final prosthesis to be made. That is, if all the implants have integrated well. So in our case, everything was fine, and the patient comes in for an appointment with me, and the oral surgeon at this point is effectively done. The objective for me at this appointment is to start making a second set of temporary implant dentures that are adjusted to how the bone and gums have healed, and with all the changes the patient wants and the changes that I want, to ensure that the final prosthesis will be exactly what they want. So we just start out this appointment by just talking about everything, how everything has went, and the changes that they desire from the current set that they have. Next, we take pictures of everything in the current status. Then we take a couple of scans again. The first scan is with the teeth in the mouth, so we can get the current bite or orientation of the teeth, since these dentures have worn down a little bit over time and over the last few months. After that scan, we remove and open up the fixed provisionals by drilling out the temporary fillings in the screw channels. Then we remove the little buffer material that we use to protect the screws from the drilling that we do to open these up. After that, we unscrew the prosthesis and completely remove it. And with everything out, we just kind of look at the conditions of the gums and everything just to make sure everything's okay. And they are looking quite nice. We also want to confirm that everything is still in the exact place as far as the implants and abutments go. So we take that OptiSplint or verification jig that we made and have disinfected from the day of the surgery. If that fits in passively and doesn't break as we put it in, we know the implants and MU abutments are still in the exact same place. So we are now ready to take some more scans and remove the OptiSplint. We then take analog or fake MU abutments and put them into the temporary dentures that we just took out of the mouth. And we scan the whole complex outside of the mouth. Doing this will orient everything to the bite scan we took inside the mouth just a few moments ago. Now with that scan done, next we put scan caps over the MU abutments in the mouth and scan the whole mouth with them in. This gives us the current position of the gums, and more importantly, these scan caps match the base scan of the OptiSplint, so we are now able to superimpose everything we are doing today with all the previous records, including the scans from months ago, the former design we made with the changes, and the pictures that match up with the scans we took a few minutes ago too. Now technically, with all of this done that I just explained, we can make the final prosthesis starting now. But we first want to make another temporary denture, because that is how we know the patient is going to be happy with the final denture. Anyway, we put these back in and we'll get the new provisional dentures back in a couple days. So in between the appointments, we get the new provisional back, and I always personally first verify the fit of the prosthetic on the analog abutments that we have set in stone, so I don't get a surprise on the actual day of the appointment. Thus, it's called a verification jig. With this temporary, we will make some adjustments with the desired changes, and we will take some liberties in doing so and kind of push the limits, since the patient will only be in this for a few weeks and can always have the previous temporaries if they hate the new changes. At the appointment, once again, we take out the temporary fillings and Teflon protecting the screws. Then we unscrew that first provisional prosthesis, and now we put in the new temporary all-on-X hybrid dentures. It takes a while to screw them into place, but we make it look quick here because this is the boring part to me. Now, once again, over each of these screws, we put the Teflon in, and then we seal off the screw channels with some temporary material that is easy to remove. The fit of these new temporary or provisional dentures is perfect right off the bat, and we check the bite too, even though the patient tells me right off the bat that they love the way they feel. Still, we confirm that it's perfect, but even if it weren't perfect, we can still adjust the bite of these new provisional dentures. Here, we make the teeth wider than what we think they are going to like, and we will bring down those upper teeth more than we think that we actually are going to do, so we can see how all this looks. The thought process behind this is, at this point, we can always go back to the previous designs or meet somewhere in the middle for the final prosthesis. And that is easier to just try and make little changes by little changes until we get to the point that they like it. It's best just to go big and then take it back some for the final prosthesis if we need to. And now with the new provisional dentures in place, this time we send the patient on the way for another 3 weeks or so. So let's fast forward to that appointment 3 weeks later. And I'm just gonna go through this appointment quickly because now we just repeat the appointment that we had a few weeks ago, where we decide any changes that we want and we take pictures and scans of everything with the scan caps and the analog MU abutments and all that sort of stuff. It's all the same as that previous appointment. And now at this appointment, after asking the patient how everything went with these, there are just a few tiny changes we're going to make, but the patient loves everything. So interesting point is, we made the teeth really white, but the patient likes how white they were. So we're only gonna back off a little bit from this whiteness because frankly, it's really white. After all the scans and prosthesis are back in place, the lab starts making the final prosthesis. And so let's go to that. In between this and the last appointment, we have the final implant dentures back from the lab. We chose to make the implant hybrid denture with a metal bar and zirconia on top of it. When you feel them, and if you were to feel this, everything is as solid as a rock and slightly heavier than they look. Again, I test everything out on the stone analogs and it lines up perfectly. So I know the final appointment is going to look and feel great without any hiccups. In fact, I am at ease because I know they're going to look similar to the provisionals that I've already made, and everything is in the exact spot. And once again, other ways that dentists do this and other ways that I did it in the past, you just don't know how the final is going to turn out until you put it in. But since this is almost a replica of the temporary prosthesis, I know this is going to be great in every way. At the final appointment, we take out the temporary dentures and put the new ones in, and we screw them in just like before. And so just like before, we tightly place these screws in there, and then we put that protecting Teflon over each of the screws in case we ever have to drill and open the screw channels again, which you likely will at some point have to do. Then we just seal off these screw channels with composite. And finally, we have arrived at the end. I love them, and so does the patient. It looks and feels as close to having your teeth back as you're going to get. And the patient is excited to eat all the food they loved once again. And this is the process of making permanent implant dentures. These are the before and afters once again. And you can watch all my videos about the benefits and things to know about hybrid dentures. But most importantly, you need a great team for these prostheses to turn out great in the end. And so just a shout out to Dr. Choi, who is the oral surgeon here from Inland Empire Oral Maxillofacial Oral Surgeons, and also Ben On, the lab technician from Cyber Ceramics, for doing this case together with me. Let me just tell you, I've never had a patient unhappy with the final prosthesis in these. And they are worth the money because they are a lot of money, but they are worth it. They are almost like having your teeth back, and you can go about with confidence in both eating, smiling, talking, everything. These are in there and they are solid. If you're in Southern California, once again, come and see me. You will have a great dentist and team working together to make you something that is going to be worth your time and money that you're investing into these. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.